Good evening. My presentation is clinical and radiographic evaluation of healing of large sepsis like inflammatory periapical lesions and triple antibiotic-based protoactive disinfection and calcium hydroxide used as root canal disinfection. This study was conducted as a postgraduate student in Government College, Calicut, Kerala, India. So, the root canal of the tooth gets infected with microorganisms. So what we can do is to chemically debride the root canal, place an intercanal medicament and seal the root canal. So what happens is that the microorganisms move into the root canal, causing a periapical lesion. So the lesion can be controlled and contained by placing a chemomechanical debridement followed by an intrapointal medication and sealing the root canal. Later, there are various intracanal medicaments available like calcium hydroxide. However, its pH is high, causing a death of microorganisms because of the high pH. The microorganisms all have an acidic pH. Then we have the Caries Research Unit at Niagara has introduced a concept called lesion sterilization tissue repair. The disadvantage, however, is causing method discoloration caused by minocycline. With an array of antibiotics available like ciprofloxacin, metronidazole and minocycline, it's called the triple antibiotic base and effective medicament against disinfection. Then next is photoactivated therapy or known as photodynamic therapy. You have a sensitizer which is activated by light and it produces free radicals and which helps in the death of microorganisms. So we did a Google search to find out which is the best medicament available as part of a clinical trial, and we did not find anything in the literature available, so that we conducted the study. It was conducted as a prospective clinical trial. 60 patients were enrolled, 20 were given calcium hydroxide, 20 were given triple antibiotic paste and 20 were given PDT. And the patient information sheet was taken, recording of data and patient recall strategies were explained to the patient. Inclusion strategy includes a teeth in the front region. 15 to 40 years of patient were included, healthy and free of any systemic diseases, who could come for a follow-up of 18 months and who had a negative response to any allergy, who had healthy gingiva and a straight root was taken up for the study. The exclusion include people with various surgeries, pregnant and lactating women with vertical root fracture, calcium degeneration and PEI index less than 3. I'll be explaining openly in the following slides. The patient recruitment was done with 1 to 3 groups. A pre-operative criteria was taken and the maxillary anterior region was taken with PEI score greater than 3. Divided into 3 groups. A follow-up of 3 months, 6 months, 12 months and 18 months was done. Bioclinical and radiographic method of analysis was done to evaluate the patient. The periapical index is graded as 1 to 5. 1 means very less periapical pathology and 5 includes a very large periapical lesion. Statistics was done for our study using SPSS software, Windows version 17, and PO index and clinical parameters was judged. Kappa test was done, chi-square test, Pascal values test, Bonferroni, and significant levels was placed as less than 0.05. We went to observations and results which we got. The pre-operative PO index score was taken as 4 and 5. And the calcium hydroxide triple antibiotic paste and photographic disinfection were 1 to 3 weeks, and most of the patients came into category 4 and very less included at category 5. After 3, 6 and 12 to 18 months, we found that calcium hydroxide group got 4 patients or 20% had moved into the recovery stage. However, in the photoactive disinfection group, 16 moved into the disinfection or moved into the healing phase. In triple antibiotic group, 12 patients moved into the healing phase. Clinical criteria of success suggests that the success criteria is more for photoactivated disinfection compared to that of calcium hydroxide group. The success according to radiographic means was also similar, with complete success was noted in photoactive disinfection, that is 16 were included in that. However, 7 were only in calcium hydroxide and triple antibiotic paste had an intermediate category of 13. So Pascal values test was done among the group with mean and standard deviation, and it was not found very significant. And Bonferroni test was also done, comparing the intergroup comparison was done, and photoactive disinfection calcium hydroxide intergroup comparison showed a significant value. These are the photographs of the lesion healing at the initial stage and at 18 months. Then we have triple antibiotic paste at the initial stage and at 18 months. It's just a single patient photograph. Then we have the photoactive disinfection at the initial stage and at the final stage, where initially you can see a radiographic radiolucent area, and in the healing phase after 18 months the radiolucency has been disappeared totally. Moving on to the discussion part, calcium hydroxide is widely used as an intracanal medicament to eliminate disinfection. It was found to be a good anti-inflammatory neutralization of acidic products and an antibacterial action. However, the longer periods of placement of this material, that is calcium hydroxide, could cause reduction in the strength of the dentine, and also because the buffering action of the dentine, the action is short-lived. So next is the triple antibiotic paste, also called as lesion stem isolate tissue repair component. Here also it was found to be very good action against deep dentine infected root canals. However, because of the discoloration of minocycline, there is a problem for the tooth. The tooth becomes black in color. To overcome this, cefaclor and fauxomycin was also proposed. Next is a triple antibiotic. After following the triple antibiotic paste, the photoactive disinfection was used. Here methylene blue or toluidine chloride dyes were employed, and the photoactivation was done using light, and this could kill organisms very easily, and resistance of the organisms was also very less. The key property of photosensitizer to be used as a root canal environment is that they should absorb the laser light in the middle red portion of the visible spectrum, since the wavelength of light given the greatest penetration of dentine and can also penetrate any blood that may be present. So it was also found as a very good disinfection agent. Toluene chloride was employed as a photosensitizer coupled with optical fiber as a light source. The use of chelating agent after instrumentation with EDTA instead of citric acid was proposed by Bonso et al. As a cleanser and disruptor of biofilm, expanding the access of toluene chloride to the root canal system. The emission of laser energy from the tip of the optical fiber is guided by a laser guide. Furthermore, thermal damage to the periapical tissues are possibility. The effective antibiotic side-firing spiral tip in removing the debris and smear helped in the more effective action of the laser tip. The radiographic method was employed by long cone technique, and healing outcome was measured at 18 months. Because 18 months was considered, because most of the follow-up studies considered 2 years as a very good conclusive data. The future scope is PDT and triple antibiotic paste need to be studied for retreatment cases and for different age groups. Here materials like propolis, simvastatin green tea may be employed. Here technologies like Dexton procedure may also be tried. Thank you for the presentation.